like be familiar with the code books, the ICD CPT, the HCPCS level 2. If you feel that you are stuck on any question, move on to the next question. And then when you have finished all the easy ones, go back to the ones that you have left. So be sure to practice with your CPT book a lot.
Welcome all. Thanks for watching this talk series. Today we will be covering the topic of what is certified professional coder and why is it important for being a medical coder. Now, we have with us Dr. Ashwini Ghate. Welcome, Dr. Ashwini Ghate. We would like yourself to just give some background of yours to the audience, and then we will start with the Q&A.
Thank you. Thank you for having me on the show. I am Dr. Ashwini Ghate. I am a homeopathic doctor as well as a certified medical coder. And I have been in this field since almost 8 years. I train candidates to become certified, as well as I work as a consultant and freelancer with different medical coding or US healthcare companies. So that's a little bit about me.
Thanks, Dr. Ashwini. So I think the first question, of course, related to the topic would be what exactly this certified professional coder exam means, or in a short form, what CPC exam means.
So CPC exam, as you correctly said, it's an abbreviation of Certified Professional Coder. It's one of the certificates that AAPC offers. There are many other certificating exams, and CPC is one of them. So it's a proficiency test to test medical coders' knowledge. The exam comprises of 100 questions covering almost 17 different areas of assessment. So there are questions from ICD coding that test the knowledge of diagnosis coding, CPT coding for procedural coding. Besides these two code sets, there are HCPCS level 2 questions. Then there are questions from anatomy, medical terminology, as well as compliance and regulatory. Then there are questions from various other specialties also, like radiology coding, pathology, E&M coding, etc. Besides these, AAPC has also introduced a new section with 10 cases. So that means there are 10 case scenarios given, and coders are supposed to assign medical codes using their code books. To complete this exam, they are given 4 hours, and the passing percentage is 70%. So, you can see now that 100 questions and 4 hours. That means it's literally a race against time. So the more proficiently you code, there are better chances of you becoming successful. Now, another important thing I would like to mention here is AAPC offers one extra attempt. In case you are not able to clear this exam in the first attempt, they will not charge you any fee for the second attempt. So it's a free attempt. So that's a little bit about CPC exam.
Okay. And after 2 attempts, there is no other attempts possible?
No. You can. They can go for exam. It's just that you will have to pay the fees again. The second attempt, second attempt is free attempt. That's what I was trying to say.
So can you talk a little bit about a breakdown of the CPC exam? I'm not sure if you answered in the previous question, but is there any details on what is the breakdown of the CPC exam?
Yeah, surely I can give you the breakdown. So as I was saying, 100 questions, and from the following areas, basically surgery coding. They cover surgery coding. So there are small case scenarios, and coders assign codes using their ICD, CPT, and HCPCS level 2 manuals. And it actually covers coding from various body systems. So like a respiratory system, cardiovascular system, then the male-female reproductive system. So besides that, there are ICD 10 questions, HCPCS level 2 questions, then the specialties that I mentioned before, the radiology, pathology, anesthesia. There are questions from anatomy, medical terminology, then compliance and regulatory, and last but not least, the 10 case scenarios. So there are actually case scenarios given with the diagnosis,